Our plans for the future are exciting. They're clinically led. They're designed to produce better healthcare, replacing present facilities with the best services possible for the generations to come. Our key staff know that doing nothing is not an option. This long-term investment, running to hundreds of millions of pounds, is needed to deliver sustainable health services for Shropshire, Telford and Wrekin and Mid Wales.
I think we've recognised that for the last few years that the facilities are not adequate to provide the level of service which patients expect.
We're stuck in a difficult situation at the moment, trying to do the best we can.
Our plan proposes one single fully staffed and equipped emergency centre at either the Royal Shrewsbury Hospital or the Princess Royal in Telford. No decision on the site will be made until a full public consultation has been held on the issue.
This is a process that's not about politics, it's not about money, it's not about cost-saving exercises, it's about patients. That's it.
This is something big, this is something fantastic, this is something wonderful to look forward to.
Whichever is chosen, both hospitals will also have 24-hour care centres, and the other hospital will have a diagnostic and treatment centre, providing better care for patients having planned surgery and other treatment. Put simply, having one state-of-the-art emergency centre will mean better treatment and better health outcomes for patients.
So it's the people on the ground, it's the doctors, the nurses. We're the guys seeing the daily effect of having services delivered on two sites. We know as clinicians that we can provide the best quality patient-centred care to the 500,000 population that we serve in this region by dedicating emergency services on one site.
If you can bring people more onto one site, you'll still have the same number of consultants and doctors, and you'll be better able to treat your patients.
I would really like it if things could change and all my appointments could be at one hospital.
Hopefully, if things were to change and we would have a purpose-built unit, we'll be able to do everything exactly as we want to be able to do it and expand our service, so see more patients sooner than what we're able to do at the moment.
To ensure a complete service for serious care, whichever site is chosen for the new emergency centre will also have women's and children's services.
Whether we're here or at Shrewsbury, it's the patients that we need to put first, and that's what our nurses and our doctors will put first.
At the moment, women's and children's services are in a new £28 million building at Telford. Whatever the decision about the future though, that money won't be wasted.
This building is a beautiful building. We've got beautiful grounds that many other patients could enjoy, whether the planned surgeries, whether it's for cancer care. They can enjoy the surroundings and the buildings, but it's about putting our patients first and putting them in the area where safest for them, whether it be Telford or Shrewsbury.
Despite the planned changes, the 24-hour care centres at each hospital will mean most patients requiring urgent but not life or limb-threatening care would be treated in the same place as now.
We will be having 24-hour walk-in services on both sites. We'll also be having a central hub where life-threatening conditions are dealt with directly, promptly and effectively.
At both sites you will be able to see doctors in clinics, you'll be able to have your investigations done, you'll be able to be seen by emergency care doctors. So overall, for the vast majority of patients, there won't be much change.
While one hospital will be chosen for emergency care, scheduled operations will be concentrated at the other site. Concentrating specific types of treatment in this way achieves better health outcomes and can also provide more convenient treatment for patients.
It would be really helpful for me, so all my care would be coordinated at the one site, and hopefully it would be a one-shop stop, so I'd only have to have a little bit of time off work rather than having to attend numerous times.
Our aim is not to run one or other hospital down, it is to provide two exciting hospitals with high-quality staff that are going to be fit for purpose for the next 30 years as we see large-scale changes in the population of Shropshire, Mid Wales, Telford and Wrekin.
The Trust is investing heavily in the new plans to ensure the best doctors and nurses can be attracted to work within a local, sustainable healthcare system providing for future generations. And those plans are backed by the people responsible for your health.
The doctors, the nurses, the people on the ground working in the hospitals, we see on a daily basis individual cases where care could have been provided to a much higher standard if the patients were treated in a single emergency centre.
We all have extended families in and around the area, and we believe we're in it together, and this is for all of us.
For the last 5 years, it has been accepted that any changes we do must be clinically led. Take the advice of the experts.
And another key reason why the medical professionals are enthusiastic is their belief that the new healthcare system will make it easier to recruit more highly qualified consultants.
You'll have a much better rota, which is much more attractive for enticing other staff members to join the trust.
We would attract the best consultants, and we would make Shropshire somewhere that people want to come and work.
The medical staff are also clear. The present system is not sustainable. Doing nothing is not an option.
This whole project is not about a winner or a loser, one hospital gaining over another, one town gaining over another. It's about creating a vibrant, safe, forward-looking emergency service for the people of Shropshire who deserve the very best.
All of our decisions are based on what we think is the best for our patients. Not about us, not about our careers, not about anything. It's about our patients.
You've heard what we have to say about this, but please get involved. No decisions have been taken yet, and I urge you to get involved in the public consultation process.